Hi, and welcome to the presentation on functional communication training and overview for direct care staff. Before we begin, let's discuss the learning objectives. We hope by the end of this presentation that you will be able to provide an overview of functional communication training, or FCT, to understand the importance of FCT, to identify learners that would benefit from FCT, to understand the ABCs of behavior, to gain an understanding of the functions of behavior, and to know the steps for implementation. What exactly is functional communication training? FCT is a procedure that utilizes differential reinforcement to teach an alternative response that serves the same purpose or class of reinforcement identified as maintaining the interfering behavior. Differential reinforcement is the implementation of reinforcing only the replacement behavior and applying extinction to all other responses. FCT is used to teach a new communicative behavior that replaces the interfering behavior. Interfering behaviors can come in many shapes and forms, but some examples include screaming, crying, running away, flopping to the ground, self-injurious behaviors, and aggression towards others. This new communicative behavior is called a replacement behavior. So why is FCT important? Well, FCT is important for a variety of reasons. Most behavior is the result of an individual trying to communicate something. FCT enables individuals to communicate their needs and wants in an appropriate way. Many parents seek services for their children based primarily on problem behaviors, and challenging behaviors can be a big barrier for individuals with developmental delays as it negatively impacts on learning. Where and with whom should FCT be used? Well, FCT has been effectively used with individuals with autism, traumatic brain injury, attention deficit disorder, attention deficit hyperactive disorder, and individuals with speech and language delays. FCT can be implemented within multiple environments, such as the home, school, and clinic, and by multiple people, such as therapists, family members, and teachers. FCT can be used with vocal and non-vocal learners. Now let's talk about the ABCs of behavior. When we talk about ABCs, we're referring to the antecedent, the behavior, and C for the consequence. Antecedent refers to what exactly is happening in the environment right before the interfering behavior occurs. Behavior means what is the behavior and what exactly does it look like. Consequence refers to what happens immediately following the behavior. It's important to look at the ABCs of behavior so we can identify the function of the behavior. When we say function, what we mean is the why. Why is this behavior occurring? So what is the function? There are many different types of functions for behaviors, and here are some: escape, avoidance, attention, tangibles, and sensory. The following video illustrates how FCT has been effective when implemented with a young girl with autism named Brittany.
I want to talk to you about how to reduce problem behavior in persons with autism and developmental disabilities, and how to replace their problem behavior with more appropriate responses. A large percentage of persons with developmental disabilities and autism tend to engage in high rates of problem behavior, and therefore skills and knowledge about how to reduce those problem behaviors are crucial for appropriate family life and overall functioning of the individual. Over the past 30 years, the field of applied behavior analysis has researched rather extensively the issue of problem behavior reduction and replacement. A body of research now exists on how to reduce interfering behaviors to their lowest levels, resulting in a more positive outcome for the family and the individual. The techniques most often used to reduce problem behavior are first to conduct a functional assessment of the problem behavior. In other words, discover the triggers or the reasons for the problem behavior, and then to teach individuals to replace those problem behaviors with effective and positive methods of intervention. Take these out for money. Take them out, Brittany. Take them out. Good. That's the way to do it. Parents frequently feel as though the problem behaviors of their children are not easily reduced and are a lifelong problem. Our research shows that with effective techniques and appropriate methodologies, many of these problem behaviors can be reduced to very low levels, resulting in a happier, more productive life for the child and the family.
What color is the paper? Purple. Very good. What color is the block? Yellow. And what color is the cup? Red. Very good. Choose one. I want pony.
Now let's discuss the steps for implementation. Prior to implementing FCT, it is important that the interfering behavior has been identified and operationally defined. An FBA has been conducted so that the function of the behavior has been determined. Identify a replacement behavior that is most appropriate and start collecting data. Create opportunities for the behavior to occur and plan opportunities for generalization, which involves teaching across multiple environments and people. Prompt the learner to use a replacement behavior, but do not reinforce the interfering behavior. Provide reinforcement when the replacement behavior occurs, and shape the response by utilizing differential reinforcement procedures. Fade the use of prompts, and use progressive time delay to delay the access to reinforcement. Monitor progress. Finally, we hope you've enjoyed this presentation and it has enhanced your overall understanding of FCT. If you have any questions, please don't hesitate to ask any of the supervisors here at the clinic.